let's talk about Asian eyelid surgery, also known as the double eyelid surgery. I know this is one of your specialties. So, Dr. Laverson, what are some of the things that people of the Asian ethnicity inquire about having when they want their eyelids changed?
Well, there's really not much difference between Asian and Caucasian in terms of wanting the eyelids done. You know, the eyes are, they're windows to our personality. The eyes have a lot to do with communication, facial expression. When we're excited, our eyes are open. When we're sleepy, our eyes are closed. They convey emotion, and you know, if patients aren't happy with certain characteristics about their eyelids, whether they're Asian or Caucasian, we try to help out and improve their situation.
So what is Asian eyelid surgery and who is a candidate?
Well, the anatomic difference, now you're saying Asian eyelid, but there's no really one Asian eyelid. There are many different characteristics, and some have a supratarsal fold and some don't. Some that have a fold that's lower than others. There's the epicanthal fold of the inner eyelid. These are just sort of different anatomical characteristics that have sort of a different penetrance depending on whether the patient is maybe Korean or Chinese or Japanese or South Pacific. You know, there are all sorts of different. Then there are other variables. For example, the measurement or the position of the eyeball, or what we call the globe, with respect to the orbit, which is the socket, you know, how far out the eye is. I mean, that changes the palpebral aperture. So there are all these different characteristics. There's no real one Asian eyelid, just like there's no one Caucasian eyelid. But again, you know, my approach is to address each patient as an individual, identify their starting point by examination, by the appropriate measurements, and then the end point that they want, what it is that's bothering them.
And what might some of those things be that are bothering them when they come in to inquire about this procedure?
Well, I would say the most common complaint is that patients want their eyes open a little more or to appear open more, and some just want a more visible crease above the lashes. And they don't really want a westernized eye. They don't want to change their ethnicity at all. They may just want a crease. Usually, I like 2 to 3 millimeters above the lashes. I mean, that's, for most patients, that's my aesthetic preference. You know, sometimes they want it higher. They want more of a hollow, more definition. But that sort of changes their look. Most patients, I find, Sheila, want to maintain their present look, just sort of appear more open or add a crease or add symmetry, because very often the crease is at a different level or non-existent, only on one side.